Hi guys, I just wanted to make a quick video. I picked up on the fact that you guys had some real confusion surrounding some of the items from discussion board from last week. So I thought that I could hopefully clear some of that up and make things a little bit better for you just by addressing it right here in a quick video. So one of the first things that I wanted to address was all of the confusion surrounding legal doctrines, and I'm really sorry if that wasn't clear enough for you either in your reading or on the lecture PowerPoint last week. So hopefully I can help clear up some of that muddy water here. So legal doctrine, doctrines are, you can think of them as the rule of law. Okay, so it's how courts over time have made decisions, and they start to do this based on precedent. What kind of decisions have been made in the past? So as patterns start to arise that the courts always sway this way based on this rule of thinking, that can sort of develop into a specific doctrine. So a good example that I like to talk about is the doctrine of the borrowed servant and respondeat superior. So say you're in the OR and there's something totally normal that can be made. Okay, so a patient comes in and they are transferring the patient from the transport cart to the OR table, okay, the OR bed. And the say there's the nurse in the OR and the surgical tech are helping to transfer this patient over, and the surgical tech is standing at the foot of the bed. They forget to lock the cart, okay, and as the patient's moving over, the cart slips out from underneath them and the patient falls to the ground and is injured. So there's a couple of ways to look at this. The doctrine of respondeat superior says that, well, this patient was injured within the OR, within the hospital. The hospital should be liable for this patient's injury. Take that a little bit further, there's captain of the ship. Well, the surgeon, that's the surgeon's room, right? He's the captain of the ship. The liability for any injury happening in that OR should go to the surgeon, right? Well, not necessarily, because based on borrowed servant, this was a normal, routine task that the nurse and the surgical tech have been properly trained in how to do. It's a normal, regular, routine procedure that we do all the time, transferring a patient from the OR cart to the OR bed, and liability will also fall on those people in particular. So even though captain of the ship and respondeat superior says the people at the top should be liable for this, it's also the responsibility for the people right there, the individual. There's doctrine of personal liability. The people personally responsible in that moment for that patient have the responsibility to be competent in their roles as well. So the liability would fall then to the nurse and the surgical tech as well. So what I'm hearing is that, well, which one applies? And the answer is that all of them do. So the courts are going to take this whole situation into account, and it's not that they have to decide which one of these legal doctrines applies to the situation. They all do. And taking the whole situation into account and figuring out exactly what happened there, it would probably fall more heavily towards one or the other of these doctrines. So they take them all into account. It's just the rule of law and the way that things are decided. Okay, so it's all based on precedent and how, meaning what decisions have been made before. Okay, so it's just what is taken into account, what is the rule of the law, what is the rule of the land, and how are we going to decide as a court who is at fault for this patient's injury, where are the consequences going to take place, basically. I hope that helps. Your book has really good introductions to some of the more applicable doctrines on page this is an older version. In chapter 2, okay? It comes right before the intentional torts, where I had you guys do that assignment for last week. So you should be able to find it pretty easy, okay? The other things I wanted to talk about were, there was some question as far as delegation. Delegation in the OR. To be delegated a task is to accept a task that would normally fall under somebody else, so like somebody else's responsibilities. So like the RN may delegate a task to you, may delegate counting or accepting specimen or pouring fluids onto the field. These are tasks that we learn, that we're properly trained to do, ideally, but are also nursing/circulator tasks. So accepting that task also accepts liability for that task if you perform it incorrectly. So any delegated task, you need to be properly trained. You need to be comfortable and confident and competent in that task. And also, you need to make sure that before you accept any delegated task, that it is an acceptable task for you to be accepting within your facility. So always be sure that you are following your facility's guidelines, because what may be an acceptable delegated task, like helping to count in one facility, will not be acceptable in another facility and could even be a fireable offense. Okay, so you need to make sure that when you get a job, after you graduate and you get a job, you know and pay attention to what your facility's guidelines are. You have to always follow policy and procedure. Okay. And also be willing to, speak up for yourself if someone tries to give you a delegated task that's inappropriate or uncomfortable for you. Maybe even it just means you need to be more completely trained in that task before you can complete it with confidence. So let's see. Another question we had was doctrine. Oh, no, we did doctrines. There was a few questions about wrong site surgery and how does this even happen, and does this even really happen? It does. It happens. It happens, and even though we have all of these steps in place, all of these different places where people check, it can happen. And even me myself, I have seen close calls in the OR. I've heard of even wrong site surgeries happening within the last few years. I've heard of them happening, not necessarily in our local hospitals, but you hear, did you hear there was a wrong site surgery in the next state over or whatever? These things do happen even in quality facilities with experienced personnel, and that's why we have all of these steps that we take, our timeouts and double checking, triple checking patient identifiers and consent forms, and even the consent forms, the most recent wrong site surgery scare that I heard of, even the patient had looked at their consent form and signed it, and it even said on their consent form that it wasn't the correct site that they were planning to have surgery on. So it was like a verbal catch. The patient, when they went into the room, the nurse asked them, where are you having your surgery today? Oh, on the left leg. And then the nurse looked, well, this consent form says it's on the right, and there's your hard stop. And that patient was already in the OR with a signed consent form. So that's a really close call that happened. How many other people did that go through? Did that get double checked through? So these things do happen, and that's why we have to be super, super vigilant to make sure that we're always taking all of the steps and necessary precautions that we need to, and then also being willing to step up and say, I need to clarify, this doesn't sound right. I just need to make sure that this is correct, and that's okay. Let's see. Finally, we had a question about scope of practice and how do we know what we're allowed to do and what we're not allowed to do. And there seemed to be some confusion there, or maybe some anxiety about how do I know that what I'm doing is okay? And how do I know that when I get to my job or my facility that I'm not breaking the rules or overstepping my rule? And first of all, as a student, you need to understand that you are a student. You're working with preceptors, and you can use those preceptors as sort of a guiding light. Okay, your instructors too, Chuck and Steve and I, are here to help you, and we're here to help guide you in that way. It's nice to know also that you have resources available to you. So do you remember your online AST assignment that you completed closer towards the first week of classes here? And I had a question on there asking you to look into the Surg Tech roles and responsibilities. That question was there to get you to go into that part of the AST website, because they have those guidelines set there for you to answer those types of questions. Am I allowed to do this in the OR? Does AST say that this is something that a surgical tech can do? So the guidelines help. In that same section is like over on the left along that same menu is something called position statements and guidelines. And in those position statements and guidelines, you'll find a whole list of generally one-page documents that say things like there'll be position statements on wound closure. Now, we teach you here that you can't do wound closure as a surgical tech. It's not allowed. And if you go into that position statement guideline, I'm saying you can't actually like hold the suture and suture that skin closed on your own, right? And if you look into that position statement and guideline from the AST, it'll say in there, it's our position that only surgical techs that have gained this further certification may perform wound closure in the operating room. So beyond just the responsibilities where it talks about things that you can do, the position statement list tells you about things you can do. And gives you references for here's the complete guidelines, at this further site. But it also will tell you about things that you shouldn't be doing. So those are two places that if you're really worried about scope of practice and you want more clarification on that, you can go to those places and take a look and read through some of those things. And I'll link those as well on Blackboard so that you'll see them. And I think that is hopefully this little video is going to clear up some of that confusion that you guys had last week. Yeah, that's about it. This is a video. I don't usually video my face, so there's also possibly a picture of my dog, so don't be put off by that. He's real cute. I hope you guys are doing great. If you have any questions, please don't hesitate to reach out to me, email, phone, come to my office hours, set up an appointment with me, and we can sit down and talk. I'm here for you. I'm a resource for you. Even though I'm online, I'm around, okay? So please don't hesitate to come to me for help if you need anything. I hope you're doing great. I hope you're having a really fun time in this program. We'll talk soon. Thanks.